Good morning, everybody. Dr. Anita here from Milan Family Chiropractic Center. You're riding in the car with the Chiro. So today's topic, I was going back and forth about it, but this one really came up literally yesterday, last night as I was leaving the office, and it's not the first time the topic came up, so I thought I should address it. So a patient asked me last night, well, doc, you did that re-exam, and we're supposed to go over it, but I don't understand why, when I come in the office, I come in and out in a couple of minutes, like what's the purpose of that? And I'm not going to have x-rays. Why didn't I get x-rays right away on that re-exam? So let me break this down for you. The reason why we chiropractors do a reevaluation is because we want to check in with you to see that we are achieving the goals we set at the beginning of your care. Whether that be I can brush my teeth at the kitchen at the bathroom sink for more than 2 minutes, or I can pick up my kids, or I can drive my car to get to work, or I can clean my house, or I can actually get some sleep so that my body can heal, or I can start going back to the gym, or I mean, I could go on for hours and hours and hours about all the things that we set goals for, depending upon you and what you present with. Um, so what happens is when we do a reevaluation, usually in about a month or so, it's because we want to check in with you to make sure that we're on the right path, that we're achieving what we started out to do. And what happens a lot of the times is at that month to 6 week mark, people start feeling incredibly well. And they get a little confused about, well, you told me I had to come for like 3, 4, or 6 months. I don't understand. I'm feeling good. And I think I failed a little bit in not responding to why we need to continue the care. So let me take this forum to do that. So we're checking in with you to make sure that we're moving up that ladder of health and healing, right? We want to make sure that that happens. But we also want to make sure that we're actually getting a correction in your spine and nervous system. And that doesn't happen in a month or 4 to 6 weeks. It's an impossibility because most people have come in with years and years of trauma or damage in their spines. And while you may feel incredibly better in a matter of 4 to 6 weeks, your body is not working incredibly better in a matter of 4 to 6 weeks in the sense that it's going to keep working better. So we have to change those neurologic and muscular patterns so that your body can adapt to the new changes and be as healthy as it's designed to be. So ultimately we can achieve the goals we set out from the get-go, whether that was to not only go back to the gym, but be able to run in a 5K, or not only to be able to run the 5K, but you want to go to a 10K or a half a marathon, to just get back into the gym and start losing weight. You've put on 20, 30 pounds and you want to be able to do weight loss, and you're just discouraged because you're always in pain. Things like that, right? Or the worst case scenario is you're not able to go to work because you're in so much pain, so we want to get you back at work. So just like diet and exercise, you have to utilize chiropractic care over a time frame repetitively in the beginning in order to create a lasting change. So then the question comes up, well, I'm in and out of the office in a couple of minutes. So, I don't understand. Well, let me explain this to you. The adjustment may take a minute or two. The healing process happens over the next 6, 8 to 12 hours after your adjustment. And so there's research out there that talks about after an adjustment, your blood pressure will lower 5 to 7 millimeters of mercury. That's huge if you are hypertensive. If you're in pain, your blood pressure goes up, so this will lower your blood pressure, not taxing your body. There is other research that talks about the fact that your body processes sugar levels, and your insulin levels will go down as a result of a chiropractic adjustment. Not immediately, but hours after that chiropractic adjustment. Then there's research that shows that your immune system is boosted up hours after a chiropractic adjustment. I think that's real important overall, but especially important when we're getting all this fear mongering about the viruses that are running amok. They've been running amok long before this particular one has been about. But it enhances your immune system to be able to do and perform the way it was designed to. So that happens for many, many hours afterwards, not the minutes that you're in my office. So yes, the adjustment time can be a couple of minutes, but the healing time is 6 to 8 to 12 hours post adjustment. So most people obviously enjoy the fact that they're able to get in and out of the office pretty quickly because we live very busy lives. But for those of you who were questioning the why behind that, I hope this gives you the answer as to why it's very quick when you get an adjustment, but that's not the healing that happens. The healing happens way after that. My job is simple. My job is to remove interference in the nervous system so your body can perform at its very best, whatever that is for you. And I do that through the chiropractic adjustment using my hands. And after that is the healing effects, the cascade of healing that happens. Sometimes that cascade of healing isn't so wonderful. Sometimes you can get inflammation. Sometimes you can get muscle spasm. So we get those and we address those as well. There's things you can do at home to help yourself out with that. If you get inflammation, you can use ice. If you get muscle spasm and not inflammation, we can talk about using moist heat. If we get a little bit of both, we might do contrast therapy between ice and heat. But there's no reason for you to have to sit in my office to do that. Those are things that you can do at home and accomplish the same results. My job is strictly to remove that interference so that your body can be at its very best. So I hope I was able to give some enlightenment on why it's quick to come in and out of my office and many chiropractors' offices who strictly adjust only. That is what chiropractic is about, the chiropractic adjustment to restore the life impulse in your body so that your body can perform at its very best. So I hope that helped you understand. You've been riding in the car with the chiro. I look forward to seeing you on the next ride. And if you have any questions about any conditions or anything you want to know about and how chiropractic works with that, I'd love to entertain that. Drop me a message and we'll talk about it. So have a great week. Be safe. It's hot as heck out there. Hydrate, 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 and get your spinal tune up. I'm on my way to my chiropractor right now. Have a great week. See you on the next ride.